Here's the simplest mental model. Imagine someone already has a borderline airway at baseline. Maybe they snore a little bit. Maybe they have a thick neck, some nasal congestion, or they sleep on their back. Then add nighttime reflux. Acid and pepsin come up into the throat. The tissues get irritated. The airway gets more inflamed, more crowded, more reactive. Now, during sleep, when muscle tone drops naturally, that airway has an even easier time collapsing. And this may become a vicious cycle because it can also go the other direction. When someone has obstructive sleep apnea, they generate very strong negative pressure in the chest, trying to breathe against a blocked airway. That pressure may favor reflux events, so the person can have OSA worsening reflux and reflux worsening upper airway symptoms, creating a loop. That bidirectional relationship is one reason patients often describe both problems at once. One of the better modern papers on this is a 2023 systematic review and meta-analysis published in the Journal of Gastroenterology and Hepatology. It found a statistically significant association between GERD and obstructive sleep apnea, with an odds ratio of 1.53, and the association remained even across different ways of diagnosing GERD and OSA. The authors concluded that an association exists between OSA and GERD independent of the screening or diagnostic methods used. That is important because it tells us that this connection keeps showing up even when the studies use different tools.